This is Steve Heuer talking about life after surgery, after the first 3 months post-op. First off, eating. At around 3 months following your surgery, you're going to advance to regular foods. It's very important to stay in contact with our program, with our bariatric dietitians to help guide you with this process. As you move forward to real food or more substantial food, take your time. Add one food at a time. Start small portions. Listen to your body. Don't let a bad reaction get you down. If you don't tolerate a certain food today, maybe in a few months you will tolerate that food. Try to get more active. You're 3 months out from surgery, so you should be ramping up your activity to maintain strong bones and muscles and cardiovascular health, and it will get you better weight loss long term. Make sure you're getting enough protein, calcium, and iron to maintain those tissues. Keep an eye out for your old habits. There's crosswinds in life, and our old habits don't leave us. They're still buried within us. Distractions, interruptions in our routine, injury or illness, old habits are still there, and they're going to sneak back in. And this is normal. Don't be bummed out if you find that some of your old habits are sliding back in. Just be aware and try to correct your course to stay on track. Not following eating rules can lead to a whole host of conditions and side effects and symptoms seen here. Remember your eating rules. Small portions. Sometimes one bite is all it takes to be too much. Listen to your body. Chew. When in doubt, spit it out. If there's dry meat that's just not breaking down, remember your pouch can't chew it for you. So it's better to get that out before you swallow and give yourself some distress there. Eat slowly. Turn off the distractions. Enjoy the small amount of food that you are eating. Of course, do not drink with your meals or immediately after, because this will flush your pouch and make it easier to continue to eat and graze all day. If you eat too much volume, of course, you can have pain and vomiting. It's good to wait 30 to 60 minutes after your last bite before you go back to fluids. Beware of grazing. Eat slowly, mindfully. Keep your meals less than 25 minutes. Make sure you're getting protein first and in every meal. And be aware that your environment can influence you. Home, work, car, your daily path can influence how you eat. So be aware of this and see if you be aware of this and try to make changes in those environments to help support your healthier behavior. Water is nutrient number one. Make sure you're drinking plenty. Of course, protein is key, and staying up with your micronutrients is very important. We ask that you drink about 80 ounces per day. This is highly variable. Again, drink enough to have to pee 5 or 6 times a day. If you're peeing less, you're not getting enough water. Protein first and at every meal. 60 grams is what we recommend for most adults. I would say shoot for 80 to 120 grams per day, at least for the first year or so after surgery. Meats, cheeses, legumes, nuts, protein shakes. There's a whole range of sources for protein. Your protein drink should have some isolate protein in the ingredients list. That's important. It doesn't have to be 100% isolate after the 3 months, but some isolate's going to digest better and absorb better. Make sure you're taking your vitamins or your micronutrients. These are really important for lifelong health. Multivitamin Complete, B complex that has at least 15 milligrams of thiamine. Under the tongue or nasal spray, B12, vitamin D, calcium citrate, and iron. Make sure your iron is ferrous gluconate or ferrous fumarate. Ferrous sulfate does not tend to absorb as well, and do not take your iron close to calcium as they tend to bind, and then neither of these absorb well. This is lifelong. Stick to the supplements. If you're not getting adequate nutrition, micronutrients or macronutrient deficiency can lead to all sorts of physical concerns, symptoms, and chronic illnesses. Some of them can be permanent. Eating rules. Avoid calorie-dense foods. High-calorie and low-nutrient foods promote craving, make it easier to get in more calories and regain your weight. Avoid or limit carbonated beverages. These can be very difficult to tolerate. They can stretch your pouch and cause pain, sometimes enlarge your pouch. Avoid or limit sweets or natural sugars. Of course, this is a sneaky way to get in calories and promote increased weight gain. It can also trigger dumping. Many folks who've had bariatric surgery will have low blood sugars after they eat sweets, so be careful of that. Avoid or limit alcohol intake. We ask that you not drink any alcohol the first year after surgery, and thereafter be very careful with alcohol intake, as you do not absorb it, as you do not digest it as completely. It absorbs more completely and very quickly, leading to a more prompt and lasting inebriation. And this can, of course, lead to weight gain, rapid intoxication, trouble with the law, liver toxicity, and we do worry about transfer of addictions. You're likely to experience a weight loss plateau. You might experience dumping, frothing, abdominal pain, various challenges with food, nausea, vomiting, constipation, or you may not experience any of these things. Weight loss plateaus are fairly common, however. Changing your activity, either ramping it up or taking a break, can sometimes trigger a plateau. Of course, eating more calories or drinking more calories can trigger a plateau. Injury or illness, not getting enough calories, these things can all trigger a few weeks of a plateau. Sometimes it just happens. You're doing everything right and you have a plateau. If this is you, then take a break from the scale for a few weeks at least. Just stop weighing yourself and focus on non-scale victories and on the lifestyle skills that you need to maintain. You may experience dumping, particularly if you eat some sweets. This is more of a phenomenon with bypass. It can happen with sleeve. Typically, it's a few minutes after eating something that's very sweet, either with honey or sugar or other natural sweetener. You may feel flushed, lightheadedness, woozy, racing heart. You may have profound fatigue, nausea, sometimes vomiting or retching, abdominal or belly discomfort, vomiting and diarrhea can happen. You may get one or all of these symptoms. It typically resolves on its own within about an hour, hour and a half. It does not affect everybody with a bypass, and it's inconsistent, meaning you may have a dumping episode in that first year and never have it again, or maybe you didn't have it and then 2 years later you do experience dumping with the same food. It's really hard to predict. It's important to be aware that cold and flu remedies often contain natural sweeteners as well as alcohol, so be careful with this kind of medication. It's always better to choose an over-the-counter tablet form of a cold and flu remedy instead of a liquid form. Frothing is an interesting phenomenon. If you eat too much or the wrong food or too quickly, or perhaps you didn't chew your food well, you've done something to irritate your esophagus or your pouch. Your body may react by pouring lots of sticky mucus into your GI tract, and often that gets regurgitated and you see all this sticky, clear, foamy bubble stuff that you didn't eat, and you're wondering, where did this come from? Well, your body secreted it, and then interpret that as a sign that something you did irritated your esophagus or your pouch. So pain with eating, if you're eating too fast, eating too much, not chewing your food well enough, perhaps you're drinking with or just after your meals, or drinking carbonated or bubbly beverages, all these things can give you pain after eating. If you're always having pain, doesn't matter what you're eating, and even drinking gives you pain and often nausea, that's a fairly reliable sign that you've got irritation or an ulcer forming in your stomach, or where the stomach connects to your intestines. We call that anastomosis. It's very, folks who have ulcers are typically folks who have gone back to nicotine. Smoking, chewing, vaping, any form of nicotine can cause ulcers in your stomach. Regular anti-inflammatory use such as Motrin, Aleve, or similar anti-inflammatories can also irritate your stomach and lead to ulcers. Sometimes ulcers just happen, but it's typically related to nicotine use or chronic anti-inflammatory use. So what do you do if you think you've got an ulcer? You let us know. You give us a call. We'll want to get you into the clinic and do an exam, maybe do some labs, and likely order endoscopy, which is a scope that looks down into your stomach through your mouth. You're asleep during this, and we'll see, is there an ulcer, is there a stricture, are there irritations, and help to guide our therapy. We'll ask that you increase your Prilosec or similar medication for a few weeks or a few months. There's some other medications we can prescribe to help calm down inflammation in your gut. We'll ask that you stop whatever behavior you might be doing that is promoting this, and we'll put you back to pureed foods for a few weeks at least, protein shakes as well. We'll probably end up doing an endoscopy again a month or 3 later just to see how the healing is progressing. If you're experiencing nausea, eating too much, eating too quickly, sugars, certain foods, all these things can trigger nausea. Sometimes if you're going too long between meals and you're starving yourself, you'll get nauseated. Poor nutrition, inadequate water intake, not taking your vitamins can all cause nausea. Certain medications and stomach illnesses can, of course, cause nausea. So again, communicate with us so that we can troubleshoot this with you. Certain foods don't go down well. Certain meats, solid, dry, tough to chew foods don't go down as well. Sometimes even ground beef may not go down well. Every patient is different. Just try it and see how you do. Thick-skinned foods such as grapes, corn, lettuce, similar type foods often are difficult to digest. Breads, pastas, rice, things of that sort can be difficult for some patients. Raw veggies and milk products and sweets are other things that sometimes cause upset stomach. Again, it really is hard to predict. It's just trial and error and moving slowly through your food repertoire to see how you tolerate it. Constipation is fairly common, mostly due to not getting enough water, perhaps fiber. And constipation is if you're passing hard stools. You can be constipated and passing stools every day, but if the stools are difficult to pass, then you truly are constipated. If they're soft and easy to pass, you are not constipated. So it's important to make sure you're getting enough water, drink enough to have to pee every 2 to 3 hours while you're awake. Modifying your diet, adjusting your fiber up or down can help with constipation. Trying magnesium, Senokot, Miralax, or similar are some over-the-counter products that can help with constipation. It's important to keep in contact with us about this, and you might need further evaluation or medications to help improve your bowel function should you have this issue. Along the same lines, diarrhea and bad gas can be fairly common the first year after surgery as you're getting used to eating after bariatric surgery. Certain foods, fatty foods, sugars, artificial sweeteners, dyes, lactose can all trigger bad gas and diarrhea. High-fat foods are probably the main cause there. What do you do? Well, of course, go back to your healthy habits, avoiding carbonated beverages. Let your protein shakes rest for 10 or 15 minutes so you let the bubbles come out before you drink that. It's helpful to keep a food diary and a symptom diary to bring into us so that we can try to identify what might be triggering any side effects or some symptoms you're having. Of course, we can modify your fiber. Some folks do well with a course of probiotics or medications. As you lose weight, you'll have extra skin and bones. This is just part of losing weight. If you're having rashes, it's important to get sun and air exposure into the skin fold area. Perhaps applying nystatin powder daily can help. There are certain prescription topical medications that can help. In the end, we typically refer you off to a plastic surgeon if you're having skin issues. As you lose weight, your bones will start to surface. So having been heavier, you grow a lot of extra bones, you have more muscle tissue, and that's all normal. As you lose weight, the bony tissues start to show up. This is fine. I wouldn't worry about it. It really is just a matter of time. Your body does tend to remodel those bones over time. Lightheadedness and bruising is fairly common in the first year or two after surgery. Remember, you've had lots of extra blood vessels supplying the fat tissue. The fat tissue is now reduced or gone. The blood vessels remain for a while. And that makes it easier to bruise. It also makes it easier for your blood to shunt out to those vessels when you're squatting down to pick something up off the ground. When you stand, you feel lightheaded and woozy. So what can you do? Maintain adequate hydration, perhaps add some salt to your diet, change positions slowly. If your blood pressure looks great and you're taking a blood pressure medicine, we'll stop that for you, but we want to manage that for you. And this does tend to get better over time as your body remodels. Bruising, same thing. You've got extra blood vessels, you've got less padding around the vessels, so it's easier to get bruised, particularly if you're more active. It is not a sign of anemia or iron problems, and it does tend to get better over time. Hair loss is fairly common about a year after surgery or so. Not balding, but just less trees in the forest, more thinning of the hair. It's more noticeable if you had a bumpy post-op course, but it does tend to get better once your weight loss has leveled off and your hair follicles have woken up and grown new hair. As your body changes, we've changed your GI anatomy. You may not absorb your medications as well. After surgery, it is more of an issue with bypass, but it can be an issue with sleeve. So as you're losing weight and getting healthier, your medication dosages need to be changed as well. So this is why it's important to have regular follow-up with us and your standard healthcare providers for the first couple of years after surgery so that we can manage and make those adjustments to your medications as needed. Staying motivated can be a challenge. Once you get to your weight loss plateau or level or nadir, we call that, you may lose that motivation. So it's important to set new goals, perhaps physical fitness goals, to stay motivated and on track. We do recommend that you come to our support groups as well. Support groups are every second Monday at this time, and you're welcome to attend those. Thank you very much, and remember, you are the pilot.